Doctor, my daughter has a rash all over her body.
Mrs., what happened during your pregnancy?
During the first trimester of my pregnancy, I developed a rash in my head and neck. Oh yes, and some swollen lymph nodes behind my ears.
Your daughter seems to have a congenital ToRCH infection.
What is a congenital ToRCH infection?
A ToRCH infection is an infection of the developing fetus or newborn. It can occur in utero, during delivery, or after birth. It can be caused by any one of a group of infectious agents indicated in the acronym ToRCH, which means Toxoplasma gondii, other agents, rubella, cytomegalovirus, and herpes simplex virus 1 and 2. And among all of them, Toxoplasma gondii, rubella, and cytomegalovirus infection are common causes of infection in all age groups. Toxoplasma gondii is the protozoan parasite that infects most species of warm-blooded animals, including humans, and causes toxoplasmosis. Besides pregnant women and infants, AIDS patients and organ transplant recipients are also vulnerable to this virus. The most common manifestations of congenital toxoplasmosis include chorioretinitis, hydrocephalus, and intracranial calcifications. Some babies with congenital toxoplasmosis may exhibit multiple purple-blue marks in the skin. The diagnosis of toxoplasma infection can be divided into prenatal diagnosis and postnatal diagnosis. Prenatal diagnosis is based on ultrasonographic signs of a congenital infection and then confirmed by PCR testing of the amniotic fluid. Postnatal diagnosis evaluation begins with a complete clinical examination and continues with serologic tests performed as soon as possible after birth, which consist of Toxoplasma IgG and IgM tests. Actually, besides after birth, it is important that pregnant women take serologic tests in every phase, from pre-pregnancy to giving birth. Women who are planning to get pregnant are supposed to take serologic tests. Those diagnosed with an acute Toxoplasma gondii infection should be counseled to wait before attempting to become pregnant. If a woman has a negative maternal serology during pregnancy, she must be informed of measures to prevent Toxoplasma gondii infection and the sequential serological follow-up. Toxo-IgM and IgG test results can be used to indicate the gestational age at the time of maternal infection and further estimate the risk and severity of fetal damage. Rubella, also known as German measles, is caused by the rubella virus, and it can be transmitted to a pregnant woman via respiratory droplets. Most children from 12 to 15 months of age get the MMR vaccine against measles, mumps, and rubella. Another way for rubella to spread is from a pregnant woman to her unborn child through the placenta. This causes congenital rubella syndrome in the fetus. Neonates born with congenital rubella syndrome usually have a triad of symptoms: hearing loss or deafness, eye abnormalities, and congenital heart disease. The prenatal diagnosis of rubella is based on PCR testing of amniotic fluid and serologic tests. After birth, evaluation begins with a clinical examination to check if there are main clinical manifestations in the infant. Depending upon clinical findings and laboratory findings, congenital rubella syndrome can be categorized into suspected, probable, infection only, or confirmed. In this case, serologic tests and viral detection can be used to determine the status. Congenital rubella syndrome is diagnosed if high-level rubella IgM is found in those under 6 months of age, or high-level IgG is found in those between 6 and 12 months of age. Then the diagnosis can be confirmed by the viral detection method. Cytomegalovirus, CMV, is a common virus that is usually harmless, which is usually transmitted through sexual contact or contact with blood and other body fluids of an infected person or from transplanted organs. The virus can also spread from an infected mother to the growing fetus through the placenta. A pregnant woman can pass CMV to her fetus following infection by CMV for the first time. Reinfection with a different CMV strain, or reactivation of a previous infection during pregnancy. Primary CMV infection in pregnant women will cause about 30% intrauterine infection, and 60% to 80% of their infected neonates will develop sequelae. In contrast, pregnant women with secondary CMV infection only have only a 0.2 to 2% risk of causing intrauterine infection. This is why it is important to identify primary CMV infection. CMV serologic tests are important for identifying primary infection, since IgM-positive result in combination with IgG avidity results are considered reliable evidence for primary infection. Congenital CMV infection is the most common intrauterine infection. Only 1 in 5 infants with congenital CMV infection will show significant signs and symptoms at birth. These include purple skin splotches or a rash or both, yellow skin and eyes, an abnormally small head, enlarged and poorly functioning liver or spleen. The diagnosis of congenital CMV infection can be made before birth or after birth. Prenatal testing includes ultrasonography of the fetus, amniocentesis to get amniotic fluid for viral culture or CMV PCR, or fetal blood sampling for CMV PCR or CMV IgM measurement. After birth, the diagnosis can be made by a clinical examination and confirmed by PCR or viral isolation obtained under 3 weeks of age from urine or saliva samples in newborns. So now you should know what a ToRCH infection is. Actually, from the symptoms of your daughter, she is probably infected with rubella virus.
If only I had known it earlier. I hope everyone can get tested for ToRCH pre-pregnancy and early stage during pregnancy.